while it would have been nice, just because the visual and the auditory makes for a better learning, but I'm definitely not reliant on it. My only disclaimer is that I do love my work and I do love the subject of mental health. So I can go on and on about it, and I'm going to really try very hard to stick to the time that I've been given. So with this, just to dive into what all of us think mental health is, right? Mental health is emotional, psychological, and social well-being. Mental health is how we think and feel and behave, definitely. But mental health is also how we learn and make decisions. Mental health is how we perceive and handle stress. Mental health is how we bond and nurture relationships, and all of that and much more. Mental is also on a continuum. It's a range from wellness to illness. At any point, I may be at any given spectrum, at any point on the spectrum. Of course, we hope more and more people are towards the wellness and not towards the illness. And that's one of the reasons that we are here together today. Mental health can change depending on circumstances as well as events, right? If I'm going through something, if I'm facing something right now, I may, if I've had a bad day, I had a fight in the house, or, my kids didn't listen to me. So I could have a low day. I could have a bad day. If I'm dealing with a grief, a loved one died, whether that's a family member who's a human, or, a, no- a dog or something like that, of course, I'm going to go through some amount of issues as well. Having said that, they're not responsible for illnesses particularly. Mental health and psychiatric illnesses are also subject to change in my internal as well as external environment. So let's say I'm someone with a metabolic disorder like diabetes or maybe a thyroid dysfunction. My chances of having a psychiatric illness like depression or anxiety increases, right? Let's say I'm a regular person, a woman going about my daily activities. Having said that, I have a severe case of PMDD, which is premenstrual dysphoric disorder. So if I'm expecting my periods, the week or 10 days or even 2 weeks before that could be more challenging as far as mental health is concerned, and I could have various issues with my mood and my behavior. So it definitely can alter with that. Let's say I come from India, so we do have a lot of tuberculosis and we have medications for tuberculosis. A lot of the times, medications for tuberculosis and even malaria for sometimes can have an effect on my internal environment and trigger mental health issues and psychiatric conditions. So it's dependent on my external and internal environment. The external environment, let's say if I have an acute trauma or a chronic stress, that can also trigger my underlying issues, and it could give rise to a mental health issue or a psychiatric illness. Another aspect of mental health is that we really do want to emphasize on mental health literacy more. We want to, because that's going to promote overall health, which is very important for us if we are going to look at our lives in totality and not just in a compartmentalized way. um, how is one supposed to kind of like figure out, right? Because I just said things like, oh, stress and things like mental health issues and a psychiatric illness. I talked about a range, it being a continuum and on a spectrum. So very simple, small little things that we could do, right? If I am looking at like a stress or a mental illness, let's, move away from wellness and just look at stress versus an illness. The first thing to look at is duration, right? Stress can be temporary. It can have, it could be because in response to a specific event or situation. Mental health disorder, on the other hand, will be persistent and long lasting, and there's no clear link to a specific event. When we are looking at impact on day-to-day functioning, on how I am being able to go about my daily activities or chores or responsibilities, whether that's at work, at home, interpersonal relationships. Now, if I'm just going through a stressful period, Stress during that time, I can manage my daily responsibilities. I may feel overwhelmed. I may not be able to function as well as I would ordinarily, but I'm managing. With a mental health illness, on the other hand, it can have a significant impairment in my day-to-day functioning. Even if I'm a student, I might not be able to focus on my studies. I might not be able to remember or understand or do problem solving. If I'm a stay-at-home wife and a mother, my ability to take care of my child or my household could also be challenged. The other aspect of what we could look at is also response to coping strategies. All of us have we do have some strategies, we do have some coping mechanisms. Now, if I'm just under a stressful situation, I'm having just mental health issues, stress, it will respond to maybe relaxation activities and techniques, breathing activities, yoga, things like that. It can also help if I have more social support. I can, if I focus more on self-care, so that's going to respond very well to it. If I have a mental health illness, on the other hand, I will require professional help. The treatment will and can include both medications and other therapies, of course, along with lifestyle management and other aspects as well. So that's how we can differentiate if I'm having a mental health issue, a stressful situation, responding to such stressful situation, or if I'm having a mental health illness. Um, what do I see? Like if I do feel that I may have a mental health illness, what do I look at? So when we think of it as physical, psychological, psychiatric, and functional, then it is a little easier for us to understand. In physical, I could have sleep disturbances, I could have appetite changes, weight changes, I could have different aches and pains, multiple physical issues on a day-to-day basis. On a psychiatric level, I could have mood swings, negative thoughts, I could worry, I could self-harm, I could have suicidal ideas, I could maybe hear voices and have perceptual abnormalities. And on a functional level, on a day-to-day level basis, I may isolate myself, I can't focus on my daily activities. But again, the difference is also about the duration. The difference is about the intensity of the situation. So that's something that we can kind of focus on and remember that if these, if physically I'm not feeling well, psychologically I'm not feeling well, and on day-to-day functioning I'm not feeling well, that may mean that I may have a psychiatric issue, a mental health illness, and I want to discuss and go see a professional. Now, who are these professionals? Professionals can be psychiatrists, definitely. Professionals can be psychologists and therapists. Professionals can be social workers who are more trained in psychiatric aspects. And of course, there are other supports professionals. I come from India. There is no uniformity of healthcare. So in such cases, we also encourage people, if you have any doubt, if you're concerned about yourself, go see your family physician or your general physician. They're easier to reach probably, with even with limited resources, you can get some amount of professional help. If they feel that yes, there is some kind of psychiatric issue and they're not being able to handle it or diagnose it for that matter, they will escalate it to a specialist. And, that's how you want to go. Now, usually what happens is when you see a psychiatrist, and so the plan is to see, first to get a diagnosis. Do you have a psychiatric illness, or are you going through an adjustment phase of something or the other? So psychiatrist is going to definitely look at various parameters and either come to a diagnosis. The best outcome are always, if you do have a psychiatric illness, the best outcomes are going to be a combination of medication, psychotherapy, and a lifestyle management plan. And that's something that you can discuss with your psychiatrist and other care providers. If you're finding it challenging, for this medication doesn't suit me, or I don't know how to manage my everyday life, or where am I going to get the psychotherapy from? All of those things are something that you can discuss with your healthcare provider. So mental health literacy at the end of the day essentially means is understanding mental health. It's the ability to recognize problematic symptoms, ability to figure out whether you're going through a mental health issue or if you're going through a psychiatric problem. And the third aspect is to also learn and know where to reach out for help, who's your friendly neighborhood psychiatrist. In India, we don't have an insurance-based healthcare. We have a public healthcare system and a private healthcare system. So it is rather easier for us to reach help more, faster than most of the developed countries out there. So it does help a lot of us for that. Of course, mental health literacy also means having the knowledge, but also the correct attitude for yourself and for the people around you that you love and care for. The attitude for promoting recognition and of psychiatric issues and mental health problems, as well as seeking, appropriate attitude towards help-seeking behavior. I always tell people, ask for help, right? We have to say no to stigma. We have to stop shaming treatment. And we have to remember that only the strong and the wise know when to ask for what kind of help and from whom. So let's all be a little wiser in that sense. Like I said, in India, there are a lot of resources available, both in private as well as public. But for those people who might not know where to even begin with, we have we have a helpline called Telemanus that has a Government of India initiative that's available everywhere all across our country. We have similar helplines available in different countries for even different disorders for that matter, which are state run, federal run, even private run as well. So reach out, ask for help. If you don't know what to do, just ask someone, ask a professional, and they will be able to help you out. And just, that always remember that when you're trying to help others, right? First, check in with yourself. Am I okay? Do I have the time and capacity to help people around me? And only then offer help, right? And if you're offering help, maybe it kind of helps to ask, what is it that they might need help with? How do they want to be helped with, rather? We're talking about just in a crisis, not like in general as such. Sometimes all they want is to be heard, and just, sometimes all they want to be is hugged and just sit there and, be with me, hold my hand. Sometimes they want to discuss issues and come up with some kind of solutions. So there are different ways of helping each other out. And I hope that I hope that a lot of us are more prepared to take care of ourselves, more prepared to take care of people around us. Work on self-compassion, definitely. Work on empathy, because that makes it easier. It makes life smoother. It makes all of us happier. And at the end of the day, if my needs are met physically as well as psychologically, I do better. I do well. That's good for me. That's good for my family, my community, and my country at large. And globally, of course, that's going to help if more of us are in a happier place than not. So with this, I'm going to just say that I wish all of y'all a very, very good mental health, and more power to you for taking care of yourself and people around you. And with this, I'm going to hand it over to Dr. Rajni to take it forward.
Thank you. Thank you so much, Dr. Ruksheda, for your incredible insights. I always believe that if you truly want to know, truly want to understand the real face, the real picture of any society, either meet any medical professional or a legal expert. Because these are the two professional professions where people witness changes in society faster than any other profession. They always have first-hand information. And considering that aspect, I would love to know, to let us know the current scenario of the society, how much social media is impacting kids psychologically as well as teenagers.
Um, Social media is omnipresent now, right? A very small percentage of the globe would be not on social media of some kind or the other. Even if people who are not on social media will have some kind of digital presence in somehow or the other. And, we know that it's always there. So clearly, when something's surrounding us so much, it is going to have an impact on us. It is not sparing adults. So we definitely know it's not sparing our children as well. Technology in itself is not an issue. Telecommunication technologies are definitely not an issue. Social media by itself is more layered, is more dangerous in that sense, because there's less supervision, or there's less, and there is more there are more chances of that impacting us negatively and creating more issues than helping them. So to say that, okay, all social media is bad and all of that is definitely not true. But we do see that there is a definite strong association between extensive use of social media and different aspects of mental health issues like focus issues, attention span issues, interpersonal issues, social interaction issues. And definitely on a personal level, we see this more in women than in men, and young girls especially, a lot of self-doubt, a lot of body image issues, a lot of insecurities. Unfortunately, these, communication technologies are also driving the loneliness in that higher. Previously we would see that older adults would be tend to be more isolated physically, and that's why there would be more loneliness. But we are seeing more and more young people now being lonely, even though they can now reach out to more people socially, but that's in fact making it worse. So social media is impacting in a lot of different ways. Again, like I said, it's how we are using it and how we are not really teaching our young people to use it. That's the point. I'm not saying it's the evil and it should be driven away from our homes, but I'm definitely going to be very, very aware of what age my child is going to be using social media, what content are they consuming, what content are they creating, how is it shaping their personalities, how is it shaping their everyday behavior. I am going to try and take care of it. But I'm not going to be able to do it if I can't get away from my smart device. So I do encourage older people, adults around children to model how not to always be stuck on their devices and how not to only look for social media. But one aspect also helps is with so much of AI that comes in, and young people are a little bit more aware because, again, of social media as well, of climate change and all of that. And if you tell them that for every time that you click a button or you write something at ChatGPT, how much power it's consuming and how much it's costing the environment, that also helps them kind of monitor how much they're using, right? Like a simple thing, like even if you're using whatever AI, when you're using please and thank you, it takes more energy and it takes more resources. Just to train our children as well of judicious use of social media and other AI generative AI tools is going to be something that is a very, very essential part of us raising them.
Okay, so doctor, just let me know one thing. How does a parent can ascertain or find out that the child needs de-addiction now and they need to possibly see a therapist?
From smart devices and social media, the addiction from social media, you
Yes,
mean?
yes, yes.
Right. So thank you so much for that question. I think that's very insightful. Like, what are the red flags? What do we look for? So if you notice that your child, and I'm saying child and not just a teenagers, because unfortunately we do see even little children, toddlers with a smart device in their hands. Not particularly social media, but we're going to talk about smart devices, not just internet and AI and all of that, but smart devices. When we see that, okay, our kids are not going to be able to have a normal conversation with us without having something on their hand, if they're not, if it's impacting their day-to-day functioning, like I said, they're not being able to sleep on time, they're missing school or college, their academics are something that's not either interesting to them, or there's scholastic performance issues. These are the other aspects, but in like from a personal point of view, if you see mood changes, if you see irritability that's increasing, if you see isolation that's increasing, if you see less interaction just with family, and maybe not because you wouldn't be able to know whether they're interacting as much outside, if you're seeing all of these things and they're consistently present or they're consistently increasing, that's definitely something for us to be a little alarmed about and reach out for professional guidance. I always tell people that if you say something, that might be labeling, but if I say as a professional, that could be a diagnosis. So I would tell parents not to just say, oh, my child is addicted and things like that. but definitely say that, okay, maybe this problematic use, and, use the right words instead of labeling your child, because that's again not going to, make it easy for you to help your child. The child is not going to be cooperative for help seeking. So when you see these red flags, and like I said, more consistently, or, an increasing in a step ladder approach, definitely take them for professional guidance and take help.
Thank you. Thank you so much, Dr. Ruksheda. And we request you to stay with us. Okay, Violeta has one question for you.
Just a quick one. I'm very much now trying to learn and observe these different natures that are evolving around us. The natural earth, authentic nature, the nature we created, which we call communities, and now this third nature, which we call the virtual world. But each of these natures has a completely different rules of behavior, do the sort of a different setups within which people evolve, right? And especially the nature 2, nature 3, we have solely created those rules. Nature 1 is up to the creator of Earth. So how do you see, I mean, well, what would you point out as the biggest difference in a way how you approach to address this challenge that you so vividly described just now, in between community-based mental health challenges and then virtual, this nature 3 based community challenges? What would be the biggest shifts or changes or upgrades or innovations to address the virtual world challenges?
So again, a very, very good question, but I think it's a little loaded. So I'm not sure whether I'll be able to do justice with the answer I'm going to attempt. So be patient and kind with me. For that to change, for us to see to it that the digital world that we are living in, or we are, also providing for our children, that's conducive to their growth, that's conducive to their health, that's conducive to their peace and happiness. We have to change on an individual level. We have to change. We have to build, make ourselves so powerful enough that we can also, talk to policymakers and see to it that those policies are in place for, because we definitely don't want to reject digital spaces, but we definitely want to make those spaces more safe. And that's not going to happen unless and until we're not going to, like I said, see to it that those changes are brought about and implemented. In India, we do have great laws and great constitution, but our challenges are about implementation. So it comes from that kind of experience as well. But I think on an individual level, if we are more if you're working more on our own integrity, if you're working on our conscientiousness, and if you're being more mindful of ourselves and of the people around us, that's also going to really, have a bottom-up approach towards also so-called cleansing the digital space, right? It's about teaching our children how to even spot what kind of content may be harmful and what kind of content is going to be okay for them. It's about teaching them how to balance their lives between the digital and the virtual. It's about us teaching them the difference between fiction and real, which is kind of getting blurred. And with more and more technology that's happening. But again, this needs to be taught, and this needs to be taught to parents. This definitely needs to be taught in schools. This needs to be taught to people in power, whether they are community leaders, whether they are government officials, whether they are policymakers. With or without all of this kind of collective effort on an individual level, community level, and policy level, we're not really going to see a lot of changes, and we're going to forever just be struggling with newer and newer challenges that we may come across. Even in the last 20 years, and the digital space has changed so much that 20 years ago, the challenges because of digital media or digital spaces was vastly different than today. Having said that, exploitation of children remains. whether we talk about, a physical, mental exploitation, or even sexual exploitation. So that is unfortunately pervasive, and that's why again, if we are more, if we're working on ourselves individually, and we're working on empowering our children, and we're also helping them learn how to empower other children, I think that's also going to be a very, very doable, like I said, bottom down to top approach. And everybody has to work together, which is, I know, a utopian, a utopian dream, but that's something that I think we do need to work towards. I hope that answers a little bit of your question. I'm not sure whether I've done justice to it.